and welcome. Tonight on High Distinction News, we are discussing the breast cancer experience, the ins and outs of treatment, and what to expect. Breast cancer is known as the most commonly diagnosed cancer in women and the second most common cancer in all of Australia. Simply put, breast cancer is the mutation of cells in the breast tissue causing tumours, and if left undiagnosed and untreated, it can spread and grow to other parts of the body. Now let's hear from Dr. Easter Jen about the common signs and symptoms that may indicate an individual that they may have breast cancer.
Cancer most commonly presents as a lump on and around the breast. However, there are more indicative signs and symptoms which can be overlooked or mistaken for other diseases. These can include thickening or dimpling of the breast skin, nipple discharge, breast pain, fatigue, and aching in bones, joints, and other parts of the body.
Firstly, the signs and symptoms of breast cancer can all be linked to the negative effects which the presence of a breast tumour has on the body. A breast mass is caused by the formation of a tumour within the breast tissue and is the most common sign of the disease. Breast tumours occur due to the uncontrolled growth of mutated cells which then grow to protrude through the breast components and tissue. Thus, the occurrence of tumours can alter the general structure of the breast and can be linked to other signs including a change in appearance and swelling, as well as causing the occurrence of other signs and symptoms which will be discussed further. Breast tumours can also be linked to the sign of thickening or dimpling of the breast tissue with an orange colour. This sign is caused by the spread of breast tumours to the lymphatic systems near the breast, which results in the leaking of lymph fluid within the breast, causing the breast to swell. This is also why the breasts convey characteristics similar to an orange, with thickening, dimpled skin with an orange colour due to the leaking of lymph fluid in the breast. The sign of nipple discharge is also related back to the occurrence of breast tumours. Firstly, nipple discharge is characterised by the weeping of white, yellow, brown, or bloody fluid from the usually one nipple of the breast. Nipple discharge is caused by the formation of a tumour in the breast ducts, causing irritation and/or obstruction. Hence, nipple discharge is also considered an early warning sign of breast cancer, since it usually occurs in one breast at the site where breast tumours start to form. A symptom of breast cancer can include the experience of breast pain. It is characterized by a feeling of tenderness and sensitivity in the breast, resulting in the sensation of pain. This is due to the formation of tumors in the breast tissue and ducts. Tumors in the breast ducts can cause inflammation and swelling of the ducts and breasts, which impact nerve pain receptors in the area, causing the sensation of pain. Breast pain can also be caused by the more advanced form of inflammatory breast cancer. Inflammatory breast cancer can cause breast pain due to the swelling of the breast from lymphedema caused by the spread of breast tumors which can obstruct the nearby lymphatic systems. Breast cancer can also result in fatigue, also referred to as cancer-related fatigue. It is described as a continuous sense of physical, mental, psychological, and cognitive exhaustion, which can leave patients feeling constantly weak, stressed, unmotivated, and depressed. Furthermore, cancer-related fatigue is caused by the general exhaustion of the body's immune system in fighting off breast cancer, whereby in fighting breast cancer, components of the body's immune system can become damaged, destroyed, mutated, or overused, which results in the feeling of fatigue. Lastly, breast cancer can also cause the symptoms of aching in the bones, joints, or other organs of the body. This is caused mainly by the rapid growth and spread of mutated cells traveling to other sites of the body either by the lymphatic or circulatory systems. This is also why the symptom of aching in other bodily sites is an ominous indicator of advanced breast cancer.
Thank you for that helpful information, Dr. Eastergen. Now let's hear from Dr. Mamo Graham about a patient's journey through the diagnostic process of breast cancer.
Thank you for the introduction. There are several diagnostic tools that are currently available which analyze breast tissue composition and assist in the diagnosis of breast cancer. This includes breast palpation examinations, mammograms, ultrasounds, MRIs, and biopsies.
Diagnosis of breast cancer can be performed through feeling for breast lumps, which can be treated effectively when detected early in the course of the disease. These breast palpation exams are recommended combined with regular screening with mammography, which is an X-ray of the breast in order to visualize the breast tissue and detect abnormalities. Further imaging using ultrasound and MRI may be used to further characterize identified lesions. Finally, a biopsy of the abnormal tissue will be taken and analyzed to identify presence of cancerous cells. A physical examination of the breast should observe the shape, color, size, and contour of the breast. Palpation using gradual pressure in circular motions around the breast following a simple U-shaped path, starting from the armpit, moving to the bra line, then to the breastbone and onto the collarbone. This should be checked in different positions. Look out for lumps, swelling, thickening, dimpling, discharge, pain, loss of contour, puckering, redness. Any changes noted in the exam should be reported to the healthcare professional as soon as possible. Breast tissue is comprised of fat, skin, blood vessels, and ductal and stromal elements of breast glands. A mammogram will show your breast tissue density. For women with dense breast tissue, breast cancer may be harder to detect as both dense tissue and cancer appear white on the mammogram, which can camouflage cancers. However, ultrasound displays cancers as dark against the white normal breast tissue, which can help detect hidden cancers. MRIs work to create an image of the breast tissue through the use of a large magnet and radio waves which display the breast image digitally. The breast MRI begins with the injection of a contrasting agent into the bloodstream, which will allow for the technician to distinguish between benign and tumorous masses within the breast. The contrasting agents will be rapidly absorbed by the blood vessels of the tumor if present, due to the increased permeability of these blood vessels of the tumor compared to the regular breast tissue. These MRI images are observed typically alongside previous mammograms and ultrasound images to further characterize the breast lesions.
Very informative, Dr. Mammogram. To educate us about the treatment options once diagnosed with breast cancer, we have Dr. Kim O'Therapy here with us today.
There are many different treatment options available today for patients who have breast cancer, each of which tailor to the individual needs. Some of these include chemotherapy, endocrine therapies, specifically the use of selective estrogen receptor modulators, and immunotherapies. These each have different mechanisms of action which aim at the reduction and/or removal of the breast cancer.
Cyclophosphamide is an anti-neoplastic agent and an immunosuppressant which inhibits protein synthesis and cell replication by cross-linking DNA and RNA, interfering with cellular metabolism. It is usually administered orally 1 to 5 milligrams per kilogram per day, or parentally 40 to 50 milligrams per kilogram every 2 to 5 days for an induction dose, and 5 to 15 milligrams per kilogram twice a week as a maintenance dose. It is metabolized in the liver and has a half-life between 3 to 12 hours. The most significant side effects associated with this drug is nausea and vomiting, hair loss, fatigue, amenorrhea, and infection due to its immunosuppressive capabilities. This drug is also very cytotoxic, so precautions should be taken to educate patients around appropriate management and disposal of bodily fluids in the home environment. Tamoxifen is a first-generation selective estrogen receptor modulator which has antagonist effects on breast tissue, which binds to estrogen receptors, depriving cancerous cells of the hormones required for cellular replication, arresting the cells during the G1 phase of the cell cycle. It is usually administered orally with a dose of 20 milligrams daily for 5 years and can be increased up to 40 milligrams depending on the needs of the patient. Tamoxifen is metabolized in the liver, forming metabolites which follow polymorphic pathways, meaning genetic differences cause variances in the effectiveness of treatment. The major side effects associated with tamoxifen is a decrease in bone mineral density due to its ability to inhibit the formation and differentiation of osteoclasts. Similarly, tamoxifen has been associated with increased risks of uterine cysts, endometrial hyperplasia, and increased risk of type 2 diabetes, lipid abnormalities, and metabolic syndrome. Patients should be educated about bone health as well as closely monitored for any signs of unusual vaginal discharge associated with uterine cysts and polyps, and for any signs of increased lipids and blood sugar levels associated with metabolic syndrome and diabetes. One of the many immunotherapy treatments of breast cancer is trastuzumab, which is a monoclonal antibody. It triggers the host's immune system to identify and attack cancerous cells by binding to HER2 receptors on the cell membrane. Trastuzumab can be administered intravenously or subcutaneously, typically every 3 weeks for a year. The intravenous loading dose is 8 milligrams per kilogram over 90 minutes, and the patient needs to be observed for the following 6 hours. Once the initial dose is tolerated, future maintenance doses of 6 milligrams per kilogram administered over 30 minutes are given, and the patient has to be watched for 2 hours following the administration. For subcutaneous administration, a loading dose of 8 milligrams per kilogram is given into the thigh as a bolus over 2 to 5 minutes, and the patient needs to be watched for 6 hours afterwards. Again, once the initial dose is tolerated, future maintenance doses of 6 milligrams per kilogram can be given over 2 to 5 minutes, and the patient needs to be watched for 2 hours following. This extended period of time of observation following the administration is because of the most common adverse effect associated with the drug is having an anaphylactic reaction. Additionally, other adverse effects include diarrhea, rashes, increased risk of cardiac dysfunction, and pulmonary complications and neutropenia.
Thanks for that insightful piece about the treatment of breast cancer. Now over to the one and only Nurse Mel Bean to hear about patient management.
In Australia, the overall 5-year survival rate for breast cancer in females is 90%. In order to maintain this high survival rate, early detection and quick nursing and medical management interventions are imperative. They have the ability to potentially lessen the severity of the cancer, killing it before it has the chance to spread to other regions of the body. The nurse has an important role in managing and assessing the patient for any alterations with their condition. This can include monitoring any risk factors, vital signs, implementing care plans, and knowing when to escalate any major changes to a doctor. The nurse has the role to inform the patient of the advantages and disadvantages of each treatment option so that they can choose the best possible option suited for them. Surgery and chemotherapy are two of the main treatment options for breast cancer, and the nurse plays a role in managing the patient before, during, and after these treatment procedures. For surgery, this will include administering analgesics, eliminating pre-surgery anxiety, ensuring all information has been handed over to the doctors, as well as ensuring the patient is fully informed. Also, the nurse will promote leg exercises and use compression bandages to reduce the risk of DVTs, as well as promoting the patient to complete exercises given by the physio. For chemotherapy, emotional support is required from the nurse, as hair loss is one of the most common adverse reactions for chemotherapy. Nausea and vomiting are also common side effects, and the nurse can manage these by administering prescribed antiemetics. The nurse should also continue to monitor pain with subjective and objective data to prevent further complications. Meticulous hand hygiene processes should be adhered to in order to promote infection control, given that patients receiving chemotherapy will have compromised immune systems, making them more susceptible to infection or disease. The nurse, in conjunction with counsellors or psychologists, can implement strategies to help the patient manage their mental health, to help cope with the sense of loss, lack of control, and the overall fear of managing this disease. Due to breast cancer commonly occurring in women, men who are diagnosed may feel isolated or embarrassed, with major emotional impacts affecting all people diagnosed, such as grief, fear of death, and loss of control. So the support of a breast cancer nurse can substantially improve the quality of life for the individual.
Thanks, Nurse Mel Bean, and thank you to all the other health professionals for their contributions. And thank you for tuning into tonight's episode of High Distinction News. See you next time. Over to you, Mark.